both as a patient and as a clinician, to me, it's everything. Like that meal means everything. When myself trying to recover, I'm of the personal belief that food is part of your treatment plan. It's medicine. Like I was saying, I was extremely weak. I didn't feel up to fighting anything at that point, and I know I feel stronger and more willing and able to do things just in general if I'm allowed to eat. So I think it contributes to that treatment plan, and with my diagnosis, it's lifelong part of your medication are the foods that you eat.
Satisfaction? I know it's a simple word. You eat and you're satisfied. You get filled up and you're satisfied. You feel good, you're happy, and you move on. You're content. It was very hard to lower those trays because they were pretty thick. So if they lowered them down and I was pushing on my stomach, I still had to get up there and eat, and try to. And it wasn't, or I'd slop it over me and I'd go, I'm going to heck with it.
So actually, when I was a friendly visitor at South Health Campus here in Calgary, one of my biggest jobs was actually opening packages for people. Because when you're an inpatient, oftentimes the hardest thing is literally, and I think it's hard for me sometimes, it depends on the day of the week, opening packages.
Like the apple sauces and a lot of the fruit stuffs were in these plastic cups with these lids, and if the manufacturer didn't have that little lip that you could pull, of course these fingers are a little on the stiff side, so they weren't cooperating as much. So yeah, a couple of times.
It seemed like every time it was supposed to be mealtime, there was someone there drawing blood or checking vitals or doing whatever, and it just, not always did it completely stop me from making me miss the meal, but it always impeded on me getting to start the meal.
In other hospitalizations, been taken out or not being brought back in time, or the tray put aside and taken out for a test, an x-ray or something, in past hospitalizations.
It'd be really cool if there was some kind of sign or some kind of thing that said eating, I don't know, switch on and off, do not disturb. Because if I had something that could make my time with my sister better, it would be oh my goodness, we can breathe, we can talk about anything, we can eat at any pace we want, we have 30 minutes and then we'll worry about people coming in. I think, and it just needs to be very clear to the people outside of the room that this is my time.
It's mealtime, it could be the one bright spot. Or if you've been in the hospital or in long-term care or anything like that for a long period of time, maybe it's the only thing that breaks up the monotony. But it's either way, I think it's paramount to have that meal be available to help, everybody do their job and heal.
someone's not eating their meal, it's a sign that maybe you really need to talk about whether their healthcare needs are being met if they can't eat.
If everything could come to a stop at mealtime, or the two main meals of the day, your lunch and your supper, or your breakfast and your supper, or even all three, and you're presented with an ambiance, the food is presented well, your needs are met. Wouldn't that be utopia? That's the word I was looking for.